I'm giving you an overview about the refrigerators we have at the pharmacy. We maintain temperatures of the refrigerator from 2 to 8 degrees Celsius, and that's mentioned on the refrigerator. We also maintain list of whatever we place in the fridge, that's displayed on the fridge. Then we have some vaccination schedules, and we maintain temperature every hour. And we also mention the temperature of the pharmacy itself. Now I'll give you a closer view as to what we have inside the refrigerator in the next video. Now I've opened the fridge and I'm showing you what's inside. These are all the medicines that are placed in the fridge. The temperature of the fridge is from 2 to 8 degrees Celsius. There's that of the cool box, which is placed right next to the refrigerator, is from 8 to 15 degrees Celsius. Some of the eye drops are also placed in the door of the refrigerator. You've got some vaccines, heparin, insulin, and some other products. Now coming to each product one by one. Starting from the most top rack. Okay. This product is called IVFC 5000. This is basically the Hcg hormone, and telling you why it's used, the product itself gives excellent description of the indications. Hypogonadotrophic disorder, cryptorchidism, hypogonadism, hypogonadotrophic eunuchoidism, spermasthenia, azoospermia, hypomenorrhea, and then hypomenorrhea or metrophagia hemorrhagica, threatened abortion, habitual abortion, primary and secondary amenorrhea, or an ovulatory cycle. So this comes in two strengths, IVFC, 5,000 international units and 1,000 international units. So this is a blue box, which is placed right here. Moving on to the next product, this is IVFM. This is a human menopausal gonadotropin, 150 international units. Indications include, in women it's used in primary and secondary amenorrhea, hypomenorrhea, anovulatory menstruation, amenorrhea after delivery, including Kyrie, Fromel or Schiam symptom, which is pituitary necrosis after delivery, Argons-Castile syndrome, which is amenorrheal galactorrhea. And in men it's also used to treat oligospermia, azoospermia, hypogonadism, and eunuchoidism. I mean, it's written on the package, on the box. This comes in one strength only, 150 international units. It's a pink box. Now, the other product we have is, let's finish these gynae products first. Okay. This is a product known as Folimon, and it's basically purified FSH, urofolitropin hormone, and it's used in ovulation induction in polycystic ovary syndrome patients who also have amenorrhea or ovulation suppression or infertility caused by hormonal imbalances as a result of high LH or FSH ratio. And it also has use in external fertilization, in vitro fertilization operation to induce superovulation in women. So Folimon, this is a green box. So they are quite similar. The green one, the pink one, IVFM, and the blue one, IVFC. So these are used in women with hormonal upset. Then I have 30C. This is again Hcg, and this is equivalent to IVFC here. This is Hcg intramuscular injection 5000 international units, and this is IVFC 5000 international units. So both these brands have the same generic, so we have a choice to choose from. Okay, now after this we move on to Clopixol. Clopixol is an antipsychotic and it comes in different strengths. This one is 100 milligrams per 2 ml. We have another one which is placed right behind, and this one is 200 milligrams per ml. So this is one product and this is different strength right here. Clopixol Depot. This one is called Clopixol Depot, 200 milligrams per ml, whereas this is called Clopixol Accuphase, and this is 100 milligrams per 2 ml of the product. So this is a 2 ml ampule and this is a 1 ml ampule, and both these boxes made by Lundbeck contain 1 ampule only. Now we have some other EPO injection placed at the back of the refrigerator. It's interesting to note that the same generic product may be available in different brands. An example would be Ferti-C and IVFC. They both contain the human chorionic gonadotropin hormone, and they both come in the same strength, 5000 international units in one vial. So both these boxes contain one vial only. On the other hand, we have the hormone Menopausal that comes in these two brands, Ferti-M and IVFM. So if I show you these two boxes, the C's written on the boxes denote the chorionic hormone, whereas M is for Menopausal. So there is a significant difference in the strength, because Ferti-M is 150 international units in one ampule, and this is one vial of the lyophilized drug plus 1 ampule of the solvent, whereas IVFM injection is 75 international units contained in a single vial. So make sure that you correct a product which has the desired strength which is mentioned on the prescription. Now this is erythropoietin hormone. The brand is Tropin. It's Tropin human. This is recombinant human erythropoietin, 6000 international units. And we have another one which is from the same maker, and it has the same brand name, but this is 4000 international units. So, and we may have a product which comes in 2000 international units. It's a disposable pre-filled syringe. So this is Tropin. Moving on to the second shelf. Here we place all the insulins, the multi-dose vials and all the pens. Here we have all types of insulins, regular, isophane and peakless insulins as well. Humulin 7030, which is a combination of 70% human insulin, isophane suspension, and 30% regular insulin. Humulin R. And please note that these are multi-dose vials and they are injected using disposable syringes, and they do not come in the form of this pen. Humulin N. Okay. Then we have these quick pens. Then you can see Levima at the back. Novamix Flex Pen 50, Epidra Solo Star. Then we have Nova Rapid Flex Pen, Novamix 30, Epidra Solo Star. And then we have the peakless insulin, Lantus solo style. Okay, so I will do a separate video in which I'll classify insulins and then I'll show various preparations that are available in the market. But for now this would do, because I'm just showing you all the preparations that we keep in the fridge. Now we've moved all the way from the top shelf to the third rack of the fridge. Here we have the thermometer. Although we use a digital scale to record the temperature of the fridge, but we also place this analog thermometer in case it's out of order, the digital one, then we use this to document temperature. Well, it's rising quite high because I've opened the door. It should be from 2 to 8 degrees Celsius, and we document that every hour. Okay, now what's this? This is a vaginal preparation that's used in candidiasis. These are 10 vaginal capsules with an applicator, and this restores the normal microbial flora of the vagina. It's mentioned on the pack for vaginal flora, and it's not for oral use, definitely. Then we have some vaccines here placed in this shelf. As I showed you some insulins in the top shelf, we have some cartridges that go in pens right here. At the extreme right we have Mixtard 30 pen fill, Humalog Mix 25, Humalog, Insulin Lispro, and then we have Humulin 7030. So Mixtard comes either in the form of a vial or in the form of a cartridge that goes into the pen. Okay, now this is Engerix-B. This is a very famous vaccine for hepatitis B. So if I take the vaccine now, how will you identify which one is the adult dose and which one is the junior dose? If you look at the adult dose, it has this little orange band over here, whereas the junior one has this dark blue band. The adult dose has this orange fun, which corresponds to the orange band, and the junior one has this dark blue band and a dark blue fun over here. So the adult dose is 20 micrograms of the antigen, whereas the junior dose is half the adult dose, which is 10 micrograms, and that's written on the back. So everything is orange, including the logo, and the adult dose, and everything is blue. Blue for babies. B in the junior dose. This is by GSK. Okay, now, excuse me. Now this is Rotavirus. This is also an oral vaccine for the rotavirus, because rotavirus is probably one of the most common causes of diarrhea in children. It's not to be injected, it's an oral suspension. It's by GSK. Okay. Then we have Synflorix. Synflorix is a combination of the pneumococcal polysaccharide and non-typable Haemophilus influenzae protein D. So it's a combination of two most common bacterial causes of community-acquired pneumonia. Synflorix. It's one dose of 0.5 ml by GSK. Then we have Menveo. Menveo is for meningitis. That's by Novartis. Intramuscular injection. It contains meningococcal group A, C, W135 and Y. It's a conjugate vaccine, and it contains the powder separately and the solution, which are reconstituted just prior to injecting to the patient, and it costs 3,100 Pakistani rupees. Manufactured by Novartis. Then we have Mussina. Mussina is again EPO, erythropoietin, which is used to increase the production of red blood cells in patients who do not have functional kidneys, because the kidneys are not making enough erythropoietin, and they are anemic, and they want this hormone to be given to be administered externally So for such patients we use EPO. Such patients often receive parenteral iron therapy, and they're also receiving hemodialysis on a regular basis, maybe 2 to 3 times a week, depending on how bad their condition is. So Mussina is a product in which they have combined EPO with a methoxy polyethylene glycol. This way they have managed to prolong the half-life of the epotin beta. Whereas the other products which I have here, the simple preparations which are just the recombinant human erythropoietin, this has a shorter half-life, and it's administered more frequently in a week, like 1 to 2 injections. But this one lasts longer, and this requires less frequent dosing. So this is 75 micrograms in 0.3 ml. And we have some other strengths also. I can see 2 other colors. This one is red, then I can see this one, the yellow one. It says 50 micrograms in the same amount of liquid, 0.3 ml, and then I can see a turquoise one, which is 100. So I'm wondering that maybe I missed a 25 25 microgram strength, but I don't have it in the pharmacy. So I have the 50 micrograms per 0.3 ml, 75 micrograms, and then I have 100 micrograms methoxy polyethylene glycol epotin beta by Roche Mussina. Okay, now then we have vaccination for rabies. This is Virorab by Sanofi Aventis. It's a rabies vaccination for human use. It costs 750 rupees. So we follow the vaccination schedule that has been specified in BNF or by the CDC or by the health department. Then we have another, this is the immunoglobulin. So this is the immunoglobulin, whereas this is the vaccine. So the immunoglobulin is used after the virus has been introduced into the patient, whereas vaccination is just used for passive immunity. Okay, in the extreme corner I have Prevena. This is again used to prevent pneumonia. Pneumococcal conjugate vaccine, 13 valent for intramuscular injection. It contains a single syringe of 0.5 ml, and it's pretty expensive. It costs approximately, what is the price? It's 5,000 rupees something. I'm not sure, but it's pretty expensive. Then we have Humatrop. This is somatropin, rDNA region for injection. 1 vial of sterile diluent and 1 container of the lyophilized powder. Combination package by Eli Lilly. It has some instructions for reconstituting, some warnings, dosage and administration guidelines. So now this is the last rack, and at the end we have the drawer right here. This is a little humidity control. Okay, here we have some muscle relaxants and some general anesthetics. These are prescription medicines, and they are strictly maintained here in the pharmacy. So let me just show you whatever muscle relaxants we have here. Atrilex, this is Atracurium, 25 milligrams in 2.5 ml. That gives you a strength of 10 milligrams per ml. And this is used to relax the muscles before intubation in patients who are undergoing a surgical procedure. So this is colored turquoise. We have another strength of Atrilax. It comes in a bigger box, and this is 50 milligrams in 5 milliliters. But again, the strength remains the same, which is 10 milligrams per ml. So this is giving 2.5 ml and 25 milligrams, whereas this gives double the dose for 5 milliliters in 50 milligrams. Atracurium for IV use only. So this comes in a small box, small ampule, the small box, and the other one comes in a dark green box. Now showing you some other brands of Atracurium. This is another one, Acuron Atracurium bisilate, and it contains 5 ampules. And what's the strength? Each ampule contains 10 milligrams of the drug, but this is in 3 ml, whereas the previous ones were 2.5 ml and 5 ml respectively. This is also given IV, and here see it says that it's to be stored at 2 to 8 degrees Celsius, and that's the temperature of the fridge we place it at. This is again a bigger box of Acuron Atracurium bisilate, and it contains 10 milligrams of the drug, but this ampule has a volume of 5 ml, whereas the small box has a volume of the small box contains ampules, each ampule containing 3 ml of liquid only. So just by comparison, the font is in dark green color, whereas the big box has the name of the brand written in red ink. Now moving on to Atracurium. This is a pretty famous brand by GlaxoSmithKline. It again has a volume of 2.5 ml. It's for IV use, and in 2.5 ml we have 25 milligrams of Atracurium bisilate. So here we have a whole pack, comes this way straight from the manufacturer. It's totally sealed. Open out. And moving on to some other drugs, we have escholine. This is Succinylcholine, which is again a muscle relaxant, but this is of a different type as compared to Atracurium, and that I'll explain in detail, because for this you need to understand the pharmacology of the muscle relaxants. Escholine. Then we have Losec. Losec is again a very famous brand. It's one of those PPIs that are available in lyophilized form. Losec, 40 milligrams of omeprazole. That's used in patients before they undergo any surgery, so that we attempt to increase the pH of the gastric contents to prevent aspiration pneumonia. And it looks something like this from the inside. You guys see that lyophilized tablet? That's reconstituted with water for injection or normal saline, whatever solvent is compatible with the product, that is mentioned in the product information leaflet that comes along with the box. And this is given before surgery. Then we have Zovirax. My god, this is one of the most famous and most broad spectrum antiviral drugs we have on the market. Acyclovir. Each vial contains 250 milligrams of acyclovir. It comes in many brands, but Zovirax is probably the most famous of all, and it's available in so many countries by the same name. So if I just show you how does it look like from the inside, it's again a lyophilized powder. So sometimes in licensure exams you get questions where the board gives you names of drugs and asks which of them would not be stable in water. So if acyclovir is one of the options, or omeprazole is one of the options. So just by comparison, you can tell that since they are available in the form of a lyophilized tablet, they are not stable if combined with water. So that's why the company makes it this way. Zovirax and Losec. So this is a pretty expensive drug, and mostly patients who have any kind of viral infection use heavy doses of acyclovir, and then we provide them with multiple vials whereby they can titrate the dose from 250 milligrams up to 500 milligrams or even a gram or so. Then we have Propofol. I mean, one of my favorite drugs. It's also called the milk of amnesia. This produces anesthesia within 10 seconds. So Diprivan is available in the US with the same name, and this is what we have here, Diprivan. It's a 10 ml vial, and a 10 ml ampule, and it contains 10 milligrams per ml. So here we have 5 ampules, each one contains 20 ml of the liquid, and this is how it looks like. Pretty milky, milk of amnesia it's called. And then we have another brand, Frisofor, 1%. This is by Fresenius Kabi, made in Austria, and it again looks milky. So this is Propofol. Every physician is familiar with this drug, and this is probably an anesthesiologist's favorite drug, and this is what we use to induce anesthesia here in Pakistan. Done. Now we move on to Influvac, because previously we had some other vaccines, flu vaccines. We had Vaccinations, we had some other ones, and this has recently come up on the market. It's by Abbott, and it's a new form of a flu shot, and it comes in these pre-filled syringes. Just take it off and you take the baby out, and it's given subcutaneously, and it's a single flu shot that lasts the whole year, and it's again pretty expensive. I don't know, one of the pre-filled syringes costs approximately 5,000 or something. Okay, so this is it. So now moving on to the final shelf of my fridge. Now we've come to the end of the fridge. Here I have okay, this is Propegra. This is the pegylated form of interferon. This is the new version of interferon because it comes in a pegylated form, and that allows the drug to circulate into the body for a longer period of time. It's a 1 ml, the strength is 80 micrograms per ml, and it's available as Pegasus in the US and the European Union. Then we have Cyclochest. This is vaginal progesterone. The pessaries or capsules, whatever you want to call them, they come in 2 strengths, 400 milligrams, and then I don't have the 201, but it also has a 200 milligram strength also. Then we have Voltral suppositories. These are used for infants who are unable to take any other form of this drug, Voltral, diclofenac, and it also comes in some other strengths. Then we have some medicines which we kept for patients who are about to have surgery in the morning, and we keep them as here. So Voltral, yeah, look at this one. This is Voltral suppository, 25 milligrams, and the other one is 100 milligrams in one suppository. Okay, now we have some insulin, Humulin placed here. This is the transparent regular insulin, and as you know that isofin insulin is cloudy, it's milky, and just by looking at the multi-dose vial you were able to tell what type of insulin it is. So moving on to the other side, again we have Voltral and some other medicines that we kept, and basically we designate this as the rear expiry rack, and all medicines which are about to be returned to the manufacturer, we place them here. Now I'll show you the drawer of my fridge.